In Canada, chronic pain touches millions of lives. Nearly 1 in 5 Canadians, that's over 7 million people, live with chronic pain, like back and neck pain, that are among the most common reasons people seek care. 4 out of 5 adults will experience back pain at some point in their lives, often leading to missed work, reduced mobility, and reliance on medication. But what if there was a gentle, drug free way to help your body heal itself, restoring balance, easing pain, and improving function? Today, we explore the growing benefits of osteopathy, a hands on approach that's helping thousands of Canadians move better, feel better, and live with less pain. Canadians are discovering how osteopathy can support recovery from back pain, headaches, joint issues, and even enhance overall wellness and prevention. Sylvain Mancuso is a practicing osteopath who is founder and director of Mancuso Clinic in Moncton, New Brunswick, Canada. He is also the president of Osteopathy Canada, where he contributes to advancing the profession across the country. Thank you so much for joining me today.
Thanks for inviting me.
So, tell us a little bit about your background and why you chose to go into this area of expertise.
I'm going to do the short version. I begin to do my study in physiotherapy in France. I come from France originally, and after a few months of practice, I was feeling that there is something else, and I can go deeper. Then I begin to try to talk with other therapists and other people in the clinic. And when many people say, "Oh, you could try to study osteopathy," then I decided to go further and do my osteopathy study in France. Is a 5 years part-time program because I was already an osteopath,
Wow.
and I really see the advantage of doing osteopathy as a add-on on physio. And but at the same time, now I'm just practicing osteopathy. I'm not a physiotherapist here in Canada.
So, how long have you been doing it in Canada?
Moved here in 2011, then
Mm.
15 years.
Wonderful. Now, as president of the Canadian Federation of Osteopaths, what is the CFO and what is its main role across Canada?
The CFO, the Canadian Federation of Osteopathy, is an umbrella organization who support association going through the regulation. And as you know, I'm sure regulation in health is
Mhm.
provincially decided. Then every province needs to, or every association needs to fight to have the regulation. And the CFO is supporting the association in every provinces to go to this regulation, because when you begin to talk with government, you need to have document like competencies or standard of practice. And the CFO, with the fact that everyone is working together, was able to create these competencies and standard with supporting every association for the regulation. At the same time, we talk with insurance and other big government body to really try to support osteopathy in Canada.
Now, according to the CFO, what exactly is manual osteopathic treatment?
I think you say that pretty well. You say
Mhm.
it's a arms drugs-free practice. Then we just use your hands. And the biggest things in osteopathy, we understand that everything works together. And you can't
Mm.
have. We are not just looking at the back; we are looking from the head to the toe, because we know that sometimes back pain it's not come from the back; it's come from the feet or all that. And it's a really hands-on approach with a whole vision of the body.
So you probably covered that then. We've got 45 seconds, but what are the guiding principles of osteopathy that shape every treatment? We had 30
The
seconds.
principle is everything works together. Then we are looking to the structure and the function together. Then the idea of osteopathy is understanding that you treat the patient from the head to the toe. You can't really just treat one area of their symptom. we are looking at the root cause of the problem and just not the symptom. That's really what we are looking. And I think it's the biggest difference in osteopathy and the approach of osteopathy.
All right. Well, stay with us. We'll be back after this break. I'm speaking today with Sylvain Mancuso, president of the Canadian Federation of Osteopaths. So, what is the history and current scope of the CFO? Like, how many professionals are there, and treatments, and how many treatments are we talking about today? So, across Canada.
I think we talk about millions treatment every year because we have an association in every province and territory almost. There is some territory that don't have association yet. Then the members of all the different association, I think we are around 8 to 10,000 now.
8 to 10,000?
I don't have exactly the number.
Yeah.
8 to 10,000, yeah, because Ontario is the big one, Quebec is a big one, and there is New Brunswick, Nova Scotia, Newfoundland, and all the West too. Then we have a bunch of different therapists all around the province, all around Canada.
So I think you mentioned you studied about 5 years, but what in France? But what education and training standards must CFO member osteopaths meet?
Okay, the biggest thing is today we are all the association with part of the CFO are following the World Health Organization standard. We create a benchmark a few years ago, then we use this benchmark to create the standard in Canada and the competencies. Then normally the standard of practice of the osteopath in provinces in Canada are the standard of the World Health Organization, and it's 4,200 hours of osteopathic schooling.
So how is manual osteopathy regulated or standardized across Canada's provinces and territories?
At the moment, the only province who is regulated is New Brunswick. Then we are really happy about that because when I'm part of New Brunswick, then I'm really excited. Then we are the first province regulated. Actually, it's the only province regulated in Canada. Then today, there is no other regulation or other province were regulated, but every provinces are working or every association are working with government to really push the regulation.
Yeah. So how does the CFO ensure high standards and public safety through its member associations?
That's one of the biggest challenge because the CFO is just the umbrella organization. We support association. And today, if you look at any regulatory body, there is a regulatory body who is protecting the public and an association who is protecting the members. Today, in many provinces, there is no regulatory body in osteopathy. Then the association is almost doing the both. Is doing helping the members to keep them up to date. Then, for example, the CU and the level of schooling and the standard of practice. But at the same time, they don't have the mandate to protect the public because they need to be a regulated college to have the right to do that. That's really the challenge we have today is the association has these two hats. And when these two hats together, it's hard to be good in both.
Okay.
Then it's why regulation is really important because with a college, we can protect the public and the association can help members to be at the right level and follow the right rules and all that.
Right. Okay. Well, stay with us. After the break, we will discuss how manual osteopathic treatments help and who it benefits. We'll be right back. We've discussed some of the history and standards in Canada set for osteopathy. Now, let's discuss the practical techniques of osteopathy for various health concerns. Okay, so how does manual osteopathic treatment actually help the body heal and restore balance as a general?
One of the big principles from Dr. Andrew Turstile was the founder of osteopathy in the 1880.
Mm,
It was helping the body healing by himself using a better mobility. Than the biggest work of the osteopath is to see where it's moving and where it's not moving. Because in my practice, often we have people coming for lower back pain on the right, but it's not come from the right, it's come from the fact that the left hip doesn't do the job. Then at the end, the right hip is working too much to compensate the
yeah, you don't
imbalance.
think about
Then
that. You're like, oh, I've got the problem here. And you're like, no, no, no.
exactly, and when you look at the body as a whole, you can see, okay, why the upper back or the posture is going to definitely change how the lower part of the body is going to work. Then, if the upper back doesn't do the job, the lower back is going to do the job. Then, at the end, you will have lower back pain. But
Mm,
if we just focus on the lower back, the pain will come back because we don't treat the root cause. And it's really how an osteopath is working, is looking at the body and say, okay, here it's not moving, here it's not moving. The pain is maybe there, but maybe there is something else. Another really big thing in what we do is the trigger. Uh,
mm,
the intensity of the trigger is going to give us the information about the health of the patient. We don't treat the same patient depending the same way depending the intensity of the trigger, because the trigger is going to give us a lot of information about the health of the patient.
right. Interesting. What kinds of health concerns or conditions do osteopaths commonly help with? We've talked about the back, but what else?
Back pain, neck pain, TMG disorder, digestive issue, knee, ankle. I think there is not really limitation about the scope of what we can do and
Hmm.
what we can help. Then it's MSK condition, musculoskeletal condition. Then it's a really large. We treat babies, pregnancy, pregnant women,
Well, that
and
was what
there
I was
is
going to
no
ask you because I was
limitation.
going to say, is it suitable for all ages, including pregnant women, infants, and seniors? And you just started to answer my question on that. So it is then.
Yeah, no, definitely. It's the only thing that's going to change is the type of techniques you are going to use. You don't use the same
Mm,
techniques on a baby than sport athletes. But there is no really age limit. And again, in the questionnaire and our evaluation, we ask medical questions about osteoporosis and all that. Then we know which type of technique is suitable for the safety of the patient. And there is no real limitation about the age from, I treat my son and he had 2 hours old. Then
yeah.
there is no really limitation.
Well, I know for myself too, when we talk about the practical side of it, I was surprised because my body, with all that I've gone through, always reacts to everything as if it's major trauma when it's not. And so I was surprised how gentle, maybe different types of movements. I'm like, why are you doing that? But it was nothing that was harsh. I maybe kind of like a pretzel movement here or there, but it was all very gentle. And it was like just little shifts using the body. And I'm like, is anything ever happening? But then I was like, wow, I feel so much better. So
Yeah,
I'm
no, because the
go
global
ahead.
movement is a lot of small movement.
Yeah.
Then if you work on the small area of restriction, the global movement is going to work better. Then it's why
Hmm.
we work on the structure side to improve the function. I'm not going to take your elbow and try to move it a lot. I just need to find where is restricted and working on it. I have a lot of patients say, I don't have the feeling you did anything, but I
Mhm.
really think about you for the next 2 days because I saw
Right.
so many things changed. Yeah, yeah.
It's so interesting. Okay, so in your experience as president and practicing osteopath, what makes osteopathy unique in supporting overall wellness and prevention compared to other things?
I think is the whole body approach, mind and spirit, and from the head to the toe, inside, outside. We have really this way to think about the patient. Again, what's the root cause? Not just focusing on the symptoms. And we have a really big different technique. We use manipulation, we use visual technique, we use fascia, we use so many things, but always respecting the principle of osteopathy, then finding where it's not moving and understand the body from the head to the toe. And I think it's really one of the things we do really, really well.
When we come back, we'll talk about what to expect at your osteopathic visit. Stay with us. Trying something new can be a little unsettling, especially when you're already in pain. Understanding what to expect at your first visit can give you the comfort and confidence you need. So let's talk about that. If someone's entertaining the idea of coming for the first time to an osteopath and they've never done this before and they have no idea, what happens during a typical first appointment with a manual osteopath?
We always begin with a full questionnaire, medical questionnaire about the health history, what happened, how long you have the pain, the medication, because sometimes some medication can have some side effect, then it's not in our field and we can refer to someone else. Then we do a full physical evaluation. We look at the medical history of the patient. And after I really like looking when I see patient walking, because the gait analysis is give us the balance, the motion, and the big advantage of that is we don't touch the patient. In my practice, I don't touch the patient because I want to see how he's moving by himself. And after, when I see how it's moving by himself, I begin to do the testing and all that. And the testing are really close to what physio-chiro or massage is going to do. We are going to test the muscle, the tendon, the mobility, the specific mobility of some joint. But in my practice, I really like the gait analysis because it's the way that I can see from the head to the toe in one shot. Because I can really say, okay, the ankle doesn't move, the knee doesn't, and from that I can begin to say, okay, I think your pains come from because this, then let's work on that.
Right. So how long do sessions usually last, and what can patients expect in a follow-up visits?
Often for an evaluation at the clinic, we do 45 minutes to 60 minutes. It gives us the time to connect with the patient because you need to know the patient, understand what's going on. Sometimes they have more things than just the physical pain, and we have the time to discuss. And that's between 45 to 60 minutes. And for the follow-up, I'm doing 30 minutes follow-up, but for a lot of osteopaths, they do 45 minutes or 60 minutes, depending what they need to treat. Again, my philosophy is more you are sick, less you can handle than if the patient is really in bad shape. I'm not going to spend 60 minutes jumping on his back. It's not going to work for him.
Right.
And he's going to think about me in the really bad way because he will have so much pain because he will, or is already not in shape. And if I had too much things on it, the risk is he's going to be more sick than it's really not we are looking for. Then we are going to, but my follow-up is 30 minutes. Maybe because I work
So what do
years,
osteopathic treatments typically cost? And is there insurance or provincial coverage? And does it change by province?
Yeah, the cost is between depending, but us it's between 100 to 140. And it's covered by almost all insurance. That's the big advantage to be in an association in the CFO, because the association in the CFO has really good report with insurance, and often members part of the this association are going to be recognized by insurance, there is the challenge because of non-regulation. There is school with a really low level of schooling. Then these people who go, we have an issue with one of them. They do 6 months online. That makes no sense for the safety of the public and the efficiency
Right.
of the therapist. But these people doing this school are not going to be covered by insurance. Then the best way to really be sure your insurance will cover, you can go on the CFO website and
Okay.
find the association, and every
Hmm.
association has their own member list where you can find people who has the right level of schooling
All right.
and the
Great
coverage of the association.
information. Thank you so much for joining us today. I'm sure this is new for a lot of people, so good for them to check into and see if it works for them. Thank you for your time.
Thanks to give us the chance to talk about osteopathy and how we can help more people.
You're welcome. I'm Julie Stellan. Thanks for watching.